can truly be a magical ingredient in a life-changing program for a man looking for hormone optimization enhancements, so the potential spike in estradiol is but a warning and not a deterrent. There is a very simple, although potentially uncomfortable way to make sure you are on the safe side when it comes to such side effects, and that is testing your blood and potentially looking into aromatase inhibitors if you are too overweight or obese to be combined with your HCG as a bridge therapy. We'll start with the blood testing part. The key here is to start HCG at a very low dosage, but beforehand, having a proper baseline reading of testosterone and estradiol before you begin HCG treatment, and then retesting 2 weeks or so after HCG treatment to see where your levels are at. It's also important to note that you should never use the standard ECLIA testing when you test these hormones. You need to use LCMS/MS in order to get a highly accurate reading on these. Now, the starting dose of HCG should be very small, but that would also depend on the age of the male and how long they've been hypogonadal for. But for the sake of example, if I were a 30-year-old athlete that started experiencing hypogonadism 1 year prior to considering HCG monotherapy as an HRT protocol and treatment, and I've already explored lifestyle modifications, and it was more trouble than it's worth, as it wouldn't ever allow me to get my total testosterone above, say, 350 nanograms per deciliter, my starting HCG dose would be no more than 250 international units, injected subcutaneously only 2 times per week, so Monday and Thursday, for example. Then after I'd have already been on that dose for 2 weeks, I'd test my testosterone and estradiol levels and compare them with my baseline before I decide to adjust the dose. And this would apply even more strictly in a 30-ish year old who's overweight, because that's when you have to really be watching out for estradiol spikes.